capsulotomy openings have been studied, cruciate and circular. However, not many studies exist comparing the different capsulotomy techniques and their effect. Now, my aim is to find whether the size and shape of Nd YAG capsulotomy has any effect over post-laser visual acuity, intraocular pressure and complications in pseudophakic patients with grade 4 pearl-type posterior capsular opacification. After IUC approval and due consent, a prospective observational study was conducted from February to July 22 in 100 eyes of 80 patients with grade 4 pearl-type PCO by a single surgeon under topical anesthesia. One month post lasers, the patient was divided into 4 groups based on the size and shape of the capsulotomy openings as follows. Group A, circular shape less than 3.5 mm opening. Group B, circular shape more than 3.5 mm opening. Group C, cruciate shape less than 3.5 mm opening. And Group D, cruciate shape more than 3.5 mm opening. The 4 groups were compared with respect to best corrected visual acuity, IOP, number of laser shots, energy used, and the rate of complications. Now, 100 eyes were divided into 4 groups of 25 eyes each. 60 patients had unilateral PCO and 20 had bilateral. 45 were males and 35 were females. Average age was between 44 to 84 years. And the average interval between cataract surgery and development of PCO was found to be around 26 to 72 months. The best corrected visual acuity 1 month post pre and post laser was found to be comparable between all the 4 groups. There was an overall improvement in the vision post laser. However, there was no significant difference found between either of the groups. IOP 1 month and pre and post laser was found to be comparable. There was no significant increase in IOP in any of the groups, and none of our patients required long-term anti-glaucoma medications. However, the number of shots and the energy required was significantly lower in group A, which was circular less than 3.5 mm, when it was compared to the other groups, which was larger in size. When pairwise comparison was done, the laser shots were found to be significantly less in circular group, which was less than 3.5 mm. Overall, the smaller size capsulotomies required lesser energy. Similarly, the total energy requirement was also found to be significantly lower in grade 1. Rate of floaters was found to be highest in group D, which was cruciate shape more than 3.5 mm capsulotic group, and the smaller size groups had lower complaints of floaters. Now, previous studies have shown that a larger size capsulotomy helped in better posterior segment examination, however, is associated with complications and hyperopic shift. In our study, we did not find any significant difference in BCVA and IOP between the small and large capsulotomies. However, patients in the large capsulotomy groups required more energy and laser shots and had more floaters. Between the two shapes, studies showed that circular capsulotomy was associated with more floaters and macular edema on day 1. In contrast, other studies found that cruciate shape was associated with more intraocular light scattering. In our current study, we found no significant difference between either of the shapes with respect to best corrected visual acuity and intraocular pressure. Also, circular capsulotomy, which was less than 3.5 mm, required the least number of shots and energy when compared to cruciate capsulotomy, which was more than 3.5 mm. Also, more patients in the cruciate capsulotomy more than 3.5 mm group required more floaters. The limitations of our study was obviously small size sample size, a short period of follow-up, and fewer parameters, as a result of which larger sample size patients are required for better. In summary, both circular and cruciate shaped capsulotomies were found to be comparable with respect to post-laser vision and IOP, but smaller capsulotomy size less than 3.5 mm required the least number of shots and energy, but with a similar visual outcome as compared to the larger size. Also, smaller size were associated with less floaters and fared better when compared to the larger capsulotomy. Thank you.